Good evening and welcome back to NeuroThursday, part 19, I believe. 18, thank you, part 18. Okay, I cannot count, so I have to look and see what's going on with my brain. So, we have been talking about the nervous system, we have been talking about the brain, and we will be talking about the nervous system, and we will be talking about the brain a lot more the coming weeks, months, and I hope years, because absolutely unthinkable to me that there are people out there treating the human body, ignoring the nervous system, which of course you can't do, because as soon as you touch somebody, talk to somebody, you're interacting with the nervous system. And in my belief, this is absolutely essential for the coming decades, that the nervous system is going to be just the normal part of the treatment plan. And one of the basic things is, of course, understanding interactions in the system. That's what we want to talk about again today. So we have talked about receptors in the periphery, about nerve function. We went through the nervous system. So if you haven't joined us before, you can go back and look at all the other episodes. They're stored on Instagram TV. They're also stored on our Neurolock Academy TV. We have all the videos there for you to look at anytime. And of course, like if you like it, okay? And if you don't like it, you don't have to like it. All right. So what are we going to do today? We're going to look at the nervous system, like I said, and we're going to look at the autonomic nervous system again. Why autonomics again? Because I believe the autonomics are so important, maybe so much more important than the other systems, because without energy, there is nothing that's going to work in the body, neither the brain, nor the muscle, nor the glands. So the absolute, what I need is ATP in the end, and what I need, of course, is the information. So, of course, if I only have ATP and I don't have any information what I should do with that ATP, nothing is going to work also. So I need information. I need a structure that the energy and information can work upon, or like the effector, like a muscle or a gland, and of course I need the energy. So, and I believe biochemistry is somewhat superior to the other parts, because, like I said, without energy, nothing is going to work at all anyway. So if you have a computer or a cell phone or whatever, and there is no battery, the battery's empty, then all your fancy apps won't do you any good, and also the phone won't do you any good. So we're going to look at this again, and what we looked at so far was, in terms of autonomic nervous system, we looked at the central autonomic nervous system, one part that is probably not mentioned in very many books, if at all. Of course, if somebody talks about autonomic nervous system, it's usually the periphery, it's usually the sympathetic, parasympathetic, the enteric nervous system. But first we looked at the central nervous system, because that's where, of course, where the brain is, and the central autonomics is what's taking care of the brain. So we looked at the lymphatics, we looked at the vascular system, we looked at the skull, and this is the moment where I started to understand what I was doing in osteopathy, when we're like trying to manipulate the mechanics of the skull. I think actually we were manipulating the autonomics of the skull, so the brain would have a better housing which it lives in and can work in. So this is what we've been doing so far, and what we want to do now is, of course, go down to the autonomic nervous system of the body and have a look at that. And we're kind of going to put this into two parts, more the thoracic system and more the abdominal systems, which of course some of the systems are kind of spread all over the place, like the hormonal system. But just want to look at a few of these aspects, and maybe have three parts then to talk about these and what they mean and what they do and what we can work with, because of course knowledge is nothing without having a practical application. Sometimes you need knowledge first before you can do something practical. Sometimes you do something practical, observe something, and you say, well, I don't know why this is working this way, and then you do the research, and then you find out, okay, this is why it works this way and not another way. Okay, so what we have in the thorax, of course, are basically two big systems. That's not the only two systems, but that's two big systems. Of course, that's the heart, or the vascular system, that's the lungs. So these are the two aspects we want to look at, and there are several aspects here. Of course, the major aspect of both of these systems is supply of the body tissues with, for example, oxygen, but also, of course, other stuff. So oxygen is fed into the vascular system, and the heart is spreading that into the body. So the body is supplied with oxygen, but also, of course, other parts are put into, or other, like glucose is put into the blood, like from the liver maybe, put into the blood and then distributed maybe to the brain. So the brain has some energy that it can turn into ATP and then burn and make some calculations and then move the body or something like that. So biochemical aspect. The big difference between these two systems is that one is directly connected to whatever system you're looking at, and the other one is just indirectly connected. So the lung has no connection to your foot, but of course there's a vascular system in your foot, and the indirect connection is that your foot needs, or the muscles in your foot need oxygen every time you step or you walk. And of course, if they have a lack of oxygen, they are going to signal to the system, to the cardiac system or the vascular system in the heart, but also to the lungs or to the sympathetic system to supply the muscle with more oxygen. So that's the way it works. That's the basic principle of physiology, is that the cell that is in need signals to the other parts of the system, also to the nervous system, of course, to say, well, can you please send us some more oxygen, or also can you please get rid of that CO2 we're producing here in excess. So one of the tricky parts in all of this can always be like finding the symptom. So sometimes it's very easy. Somebody coming in with a knee pain or maybe a leg pain. So you're thinking, well, what could this be? This could be something mechanical. This could be something proprioceptive, something with the motor function of the muscle. Of course, this could be something with a nerve, but of course, it could also be something with the blood vessels or the lymphatics. So the way we look at this is that if there is such a problem, we're always looking for communication. That's the basic idea we're working with this part of the body and some other part of the body need to interact, because this part of the body, maybe your muscle needs oxygen. This part of the body can supply the body with oxygen, so they have to communicate, because if I'm just using this muscle for something, not all the other parts need oxygen, but this one does. So this one has to have the ability to signal a lack of oxygen to other parts of the body that are supposed to be supplying it with oxygen. So this is what's going to happen, and what they found out through the years, and this was not obvious to me, and of course that's not how it was described in most of the textbooks I was reading, is that this communication does not necessarily have to go through the central nervous system. So of course there's a lot of systems, especially in the brain stem, that are regulating the cardiovascular system, but there is some other system, that's the paravertebral ganglia, so like the sympathetic system, and we now know that the body part I'm looking at, or the body part that is maybe dysfunctional, can directly, in theory, communicate through the paravertebral system with the heart. So that's established as a fact now, and for a very long time, I always thought that everything must be regulated through the central nervous system, because you have all the representations in the central nervous system. So if you're testing, if you're diagnosing, there has to be some part, I would say, broken in the central nervous system, in the brain stem or so, that represents that dysfunction in the body. But that was not the case. So I was kind of wondering why can I not find the problem? If I can see the problem in the periphery and the function, why can I not find the representation in the brain for that? And the reason was that there sometimes is no representation in the brain. It's just the connection between two distal or two peripheral systems communicating with each other through the sympathetics without involving the central nervous system. So one of the hard parts could be finding the symptom, not the symptom, but finding the structure that represents the symptom. Like if somebody comes in and says, well, I tend to get the flu or bacteria in my system a lot, or I have a poor digestion, They're not saying, well, I have a stomach ache, but they're saying I have a poor digestion. Of course, reasoning, logic is one aspect of finding the problem. But of course, we also teach ways of identifying the problem through palpation, through structural changes, etc., to find where do I need to look, because sometimes I have a symptom that's very obvious, like a leg pain or knee pain. Sometimes I have a symptom that is not very obvious, but I need a structure. I need some kind of system I need to work with. So let's go back to where we were right here. So this is one part of the body. Let's say we're going back to our leg, and now I'm basically testing the vasculature of my leg to the system of the heart through the sympathetic nervous system. That's probably where we're testing, especially if there's no central representation. And of course, there is a blood vessel in that system. So sometimes it's just the innervation of the blood vessel. And one of the aspects that is always or plays a key role, of course, in the blood vessel system is pressure. So very often, when this shows up, that there's a problem in the communication with the blood vessels or the heart, I can trigger the dysfunction through the blood vessels. So, I mean, you can palpate a lot of blood vessels in the body. You just go on the blood vessel. Then if you have a problem like with your wrist or with your leg, you go onto the blood vessel and you just palpate it and you push on it or you pull on it a little bit, and that will probably cause the dysfunction you're looking for. Or it's in the communication with the heart, really, because the heart needs to pump more, and this is what's happening. The body's working, the heart starts to pump more. Everybody knows that. I go up the stairs, my heart starts to go up 5 beats, 10 beats per minute, 20 beats per minute, depending on how well I am in my endurance. So this is one of the parts of the system that is very important. I see a lot of problems in the vascular system. That is very interesting. Of course, it has a very high stand, I might want to say, in the hierarchy of the systems, because as we know, and also osteopathy, for all the osteopaths out there, is always the rule of the artery. And of course, we know in medicine, one of the most occurring urgency in everyday life is some problem in the vascular system, whether it be a heart attack or a stroke. So that happens a lot to a lot of people every day, and that is very life-threatening, of course. But the people who are coming to see me, of course, they're not threatened with their life. Otherwise, they wouldn't come to see me. They would go to a hospital. But they have some kind of other problem, which doesn't mean it's not the vascular system. So that's a big misunderstanding. Sometimes people think, well, if it's a problem with my blood vessel, then that must be a very bad problem. Should I not go to the hospital? I say, no, well, it's just the blood vessel is also a motor system. It's also muscle. So that has to be regulated by the sympathetic nervous system. And if it's just a minor problem, it could just be that I go for a run, and when I go for a run, after 15 minutes, I get my leg pain or knee pain because my muscle is not supplied as it should be, and there I'm at a high level of intensity or a medium level of intensity, and of course then it's going to be obvious. And if I just walk around in the office or in my practice, it's not going to be that obvious. So these are the little things, the little dysfunctions that can get obvious once the system is asked for a change, or if there's a greater need for oxygen or whatever the body has to deal with. So this is vascular system. So let's just switch to the system in the thorax, which is the breathing system, or the lungs. And of course, the breathing system does not only consist of the lungs. The lungs are just one part, which are taking care of the exchange of gases. But of course, you have a whole bunch of things around. And here, one thing that's very interesting is that, of course, you have the biochemical aspects. And of course, if you need more oxygen, your bronchi should open up, so there's bigger airflow going into. And this is, of course, all regulated with sympathetic, parasympathetic nervous system. The sympathetics opening up and the parasympathetics closing it down more. One aspect that I could mention at this point is that one part that's very important is norepinephrine that's released from the adrenals into the bloodstream, and which is one major component of opening up the bronchi. So if I treat people with asthma, very often I see a problem between lung function and adrenal function. So there's a miscommunication at that level. But let's just skip that and go back to this part. And of course, one aspect is biochemistry. So you have the biochemistry of exchanging gases, but also maybe more often occurring, that's why I want to mention here, one thing that occurs more often is the mechanical aspect, because here you have one part of the body that moves like 20,000 to 25,000 times a day, of course, all day and all night. During the day, maybe a little more than during the night, hopefully. And this mechanical system might interfere with other mechanical systems. So you have a whole bunch of muscles that go around the thorax that also are involved in the biomechanics of the thorax, but maybe they're also more involved with the way I move my arms, I use my arms, and they should not interfere with each other. So we have this aspect of mechanics in the thorax having to be there because I need to breathe all the time, and the mechanics of the body like locomotion or carrying or grabbing something, and this has to be there has to be a consensus that this is okay, and there has to be like a mechanism saying, well, now I need to release that muscle because I need to get more air into my body, because if I contract certain muscles like my pectoralis or my latissimus dorsi, I will hinder the thorax to open up, and I don't want that to happen if I needed more air to come inside. So also another thing, like the interaction between like parts of the body that are used for locomotion or for other things, and other parts of the body like the glands in the abdomen. So breathing, everything moves up and down all the time, and there should not be a sensory mismatch between what's happening in the thorax and what's happening in the abdomen. So if I'm breathing in, or if I'm breathing 20,000 times a day, and 20,000 times a day my stomach says, well, somebody's pushing on me, what's going on? This could cause discomfort in the upper parts of the abdomen. This could cause discomfort in the thorax, and this could be an interaction problem or a mismatch problem between what's going on in the abdomen and what's going on in the thorax. And usually what the brain should be aware of, that it's okay that if I take a deep breath in, all my glands are going to be pushed down. And if this is not happening because there's some kind of mismatch in the information the brain is getting, maybe through a distortion, through the phrenic nerve or whatever part of the body, this could cause like something like stress, because the body's saying, well, 20,000 times a day, somebody's pushing my stomach, what the hell's going on? So, of course, this shouldn't be, and this is one of the major aspects also said to be what the nervous system is supposed to do is merge information like sensory information, visual, auditory, smell, but also, of course, in the body, movement of the glands, movement of the body. Also, of course, if I move here, if I just walk, something is moving inside, not only outside, and this should be okay. The body should not say, oh my God, my liver is going back and forth. What the hell's going on with the liver? Well, I'm just taking a walk, nothing big going on. So this is communication, merging of information in the brain, sensory information, and the brain should say at that point, well, that's perfectly fine. When I breathe in, it should push down. Maybe it's a problem if it's not pushing down. And what can happen? It can block breathing. The body can block breathing, or the brain can block the breathing. Say, well, stop pushing on my stomach. My stomach is saying that something is wrong there. So this is also what we want to take care of course, through testing, seeing if mechanics of the abdomen and mechanics of the thorax are okay with each other. They're congruent. They're not like in a mismatch situation. And this, of course, also in terms of thorax movement and movement, for example, of the upper limbs. And that's what we want to take a look at now. This is why my daughter is here today. Thank you very much for joining me, because I said I want to show something again. I might not be able to show something that I can treat or integrate, but I just want to show how you can easily test the function between, or the coordination between movements of the limbs and movements of the thorax. So, basic aspect of muscle function. So when I see people using muscle tests, usually they just test if the muscle is strong or not strong. Yeah, that's one part of the system. So we use that in neurology, of course, just as a muscle function test. In kinesiology, it's also used as like an indicator for something else, using nosodes or whatever they use. What we consider to be important here also is, of course, not only is the muscle able to contract, also is the muscle able to relax. So inhibitory function of the muscle is very important, and integrated function of the muscle is very important. So the muscle is not behaving the same in all situations. So if I test the muscle, it should change its pattern in terms of what's going on somewhere else in the body. So let's try this. Very easy. Everybody can do this at home. Everybody can try this right now or later on. So if you want to test the pectoralis pars, the sternal part of the pectoralis, you just turn the arms inwards like this, at least 90 degrees, or you can turn them inwards even a little more, and then you push towards the middle. So I can test both arms at the same time. Please hold very strong. So, of course, I'm strong. My daughter is also strong, of course, but not as strong as I am. So I could easily pull her arms apart if I wanted to. So I have to calibrate to see how good is her strength. Okay, so no problem there. So what we can do now, I can just go on both muscles and go and pinch the muscle a little bit so I can activate the muscle spindles on both sides. Hold very strong. Okay, and the muscle will go a little weaker. It will inhibit it a little bit. That's normal. That's a physiological function. And quite often when I look at somebody, like somebody coming in with a shoulder pain, all the muscles I'm testing are working just fine, but some of the muscles are not inhibiting, so they're not responding to a stimulus in the spindle. So that's already a neurological problem right there. So if there would be a problem here, I would have to fix that. So next step would be, okay, muscle is can be activated, muscle can be deactivated through a spindle. Of course, if you try this, you always have to go in the direction of the muscle because that's the way the spindles are in the muscle. So that would be a spindle test. Now what we want to do is see how does the muscle react to breathing. Of course, it should change its function. And here there is a discrepancy between what you test and what is in the literature, because the literature is saying if they do EMGs, the literature is saying there's more activation in the muscle, in the pectoralis, and also in the latissimus dorsi. There's more activation when somebody breathes in, which could translate into it's getting stronger, but it doesn't. Okay, it does not get stronger. Everybody knows that because everybody who's doing some work with weights and they're doing a bench press, nobody breathes in to do a bench press. Everybody breathes out. Why? Because when you breathe out, the muscle can be activated. When you breathe in, the muscle gets deactivated to give it some room, to give the thorax some room. So breathe in, deep breath in, hold, and hold very strong. So now the muscle is being inhibited. It's getting weaker. And how could that be translated from the EMG? Maybe the EMG is signaling that the muscle is giving itself length automatically. Everybody's thinking of contraction of a muscle. I believe, that's what I think, I don't know if there's any literature out there, I haven't found it yet, that the muscle can actively elongate also. Every muscle can probably do that in some way. So, but that's just in terms of interpreting the EMG. What we test, and this is what's functionally happening, the muscle is activated. Once you breathe in, the muscle gets inhibited. Well, you can try this. This is very logical, actually, because if you want to breathe in, it'd be good that your thorax can open up and the shoulders have to go outside a little bit, so the muscles have to lengthen, right? If I contract the muscles like the pectoralis and the latissimus dorsi and I try to inhale, that's not going to work very well. I have to force my way through the muscle, right? So this makes a whole bunch of sense. So let's check the latissimus dorsi. So please turn around a bit. Okay, so turn the arm inwards all the way, so then you have your the back of the hand against your hips and hold very strong against your hip. So muscle is being activated. I can go onto the muscle and just give it here some spindle stimulus and hold very strong. And here the muscle goes again and weakens. Okay, so that's very normal. So this also means this muscle is functioning normally. Could do that on the other side. Also, we already tried this before. No problem at all. And what we're going to do now again, and I say thank you for stopping by, and you can watch this anytime on Instagram TV. We're recording this or we're posting it on Instagram TV, and also, of course, on our YouTube channel, Neurolog Academy TV, if you haven't noticed yet. So now what we're going to do is do the same thing as we did with the pectoralis, test it, what happens when she breathes. So please turn around again. And now we're going to test this again, but now she's going to take a deep breath in. So breathe in all the way, breathe in, breathe in, breathe in, breathe in, breathe in, breathe in, and hold very strong. Okay, so this is happening now with breathing in. So the muscle gets inhibited. That's normal. That's integrated muscle function. So this is happening all over the body. Of course, breathing is very important. I just had a patient today, had 2 crashes with his bike, one with a mountain bike, fell on his left side, broke a rib. The second one with his racing bike fell on the right shoulder, broke his clavicular system here. What does he have? He doesn't have any breathing problem, but he has problem with arm movements. So there's like a restriction. It doesn't feel right. The arm swing is no good, and even there's sometimes some pain, and movement is not good. 3 months after the one crash and 1 year after the other crash. So he came to see me, and what did we find? We found exactly this pattern, but with him, both of those did not work. So there was no inhibition in the muscle, which then, of course, either inhibits the breathing, which is not happening so much when I see patients or when I talk to patients. Most of them say I have some kind of restrictions in my movement of my arms, my shoulders, my neck. Some say they have a restriction in their breathing, but many more people say they have restriction in their body movement, which makes a whole lot of sense to me, because the brain will probably say, well, breathing is more important than moving my arms. I can just walk around like this all the time and I can still function, but if I can't breathe anymore, this might cause me more trouble. So another function I can show, up, all the way up, all the way up. Hold very strong right here. So test the muscles up here. It's also the subclaviculus that is being tested this way. Of course, that's not the major muscle. Now this system or this setup reacts to expiration. So exhale, inhale, deep inhale, and then exhale all the way. Out, 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 and hold very strong. Hold very strong. Okay, and there we have the same again. It inhibits. Okay. So this is one very big part of what we do when we test integrated muscle function. Breathing, of course, were very important. I almost look at this with every patient unless they don't come with a problem up here, but of course also the function of the legs, because we say that breathing starts at, I don't know, C2 and goes all the way down to L3. So you could have dysfunctions anywhere in this area in reaction to breathing or in coordination to breathing. Okay, so there's no problem here. So, but what would we do if there would be a problem? So a lot of times, especially if there's a coordination problem with breathing and moving, the brainstem is involved. So there's 2 ways of accessing brainstem. One is through contacts. We have a whole bunch of contacts on the skull and on the face and on the head that correlate with functions inside the brain, certain brain areas, like the medulla, like we can touch it right here under the jawline here. We can go right there and touch this part. This would correlate with certain functions of the medulla, like rolling your tongue, like moving your tongue. So that's cranial nerve 12. So that's originated in the medulla. So the nuclei are in the medulla. And so what you can do also, sometimes it doesn't work all the time, because of course there's other functions also. You can have the patient move their tongue around in their mouth and then ask them, like, let's say this is not working. So she breathes in and the muscle is not inhibiting on this side right here. And you're testing for medullary inhibition or activation of the medulla to inhibit the muscle while breathing in. So then what you do is you let your patient move their tongue around their mouth. So they're just moving their tongue around the mouth. That gives some some activation in the brainstem. And then you let them breathe in deeply, and then you let them hold the muscle. So if it then inhibits with the tongue moving around, and you don't have to do that while you're testing, you can also do that before, just pre-activate the system, then you can integrate that. And integrate that with us always means moving the tongue around, breathing, taking deep breath in, and activating the skull, for whatever reason that is working. I've been doing this for 18 years. I've been treated a whole bunch of things in my practice, and yes, this works. Three things: breathing, moving the tongue, tapping can take away issues that might have been there for months or years, which couldn't be resolved through training or mobility training or whatever, which could only be resolved by resetting the nervous system, which is what we're probably doing. So this could be what you would be doing to reset the breathing. So does the tongue have anything to do with breathing? And this is one of the logical things that's happening in neurology a lot, or in functional neurology. What's the deal with the tongue? Why would the tongue maybe work more than something else? Well, every time you breathe, your tongue moves forward. Every time you breathe in, it moves forward, and when you breathe out, it kind of moves backwards again. Why? Well, it's creating some space, because like right there, here the muscle is creating space, here the tongue also is creating space, so it's connected. And the nuclei of the tongue are very close to the other nuclei of other systems that have to do with breathing, for example. So also facial systems, like you have to be able to open your mouth to breathe. So also some of the nuclei of the face are close to the nuclei of the breathing system in the pons, for example. Okay, so this is then functional neurology, of course, and the basic is, of course, anatomy, knowing the function, knowing the integrated function, which is very important to us, how everything integrates with each other, and if it doesn't integrate, if it doesn't coordinate, if it doesn't work together, if there's like a mismatch between the systems, well, then of course you have to fix it. So this is what I wanted to talk about, and I'm perfect on time. I wanted to talk for half an hour, and I did talk for 31 minutes. So I just want to say thank you for watching today. If you're interested in this, of course, we have a whole bunch of videos on Instagram TV, a whole bunch of videos on YouTube, on our Neurolog Academy TV. We even have in English at the moment one of our seminar one. And I'm saying one because it's a little bit older version. Older version means it's a version from last year. So we have that for free, all the videos and also the manuals. You can have a look at that for free if you want to. Check it out, and if you're interested, okay, stay tuned, because we're going to be teaching in English probably at the end of this year in fall, very probably in Copenhagen. Yes, so we are starting to set up an English seminar or English seminars teaching all the stuff we're doing, neurofunctional integration, functional neurology, functional medicine, all that stuff. So thank you for watching. Stay tuned. I'll be back in 3 weeks already with episode 19. Thank you, and bye-bye.